Good evening, everyone, and welcome to today's webcast, Psoriasis Flares. My name is Kathleen Carter, and I will be your moderator for tonight's presentation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. We've taken a screenshot of the attendee interface. You should see something that looks like this on your own computer desktop in the upper right corner. You have joined the presentation listening using your computer speaker system by default. This means if you can hear music through your computer, you should be able to hear the presentation. If you prefer to join over the telephone, just select Use Telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenter by typing into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address as many as possible at the end. Before I introduce today's speaker, I'd like to take a moment to tell those of you who may be new to the Foundation about who we are, our mission, and what we do. In 2014, the National Psoriasis Foundation developed a new strategic plan which drives everything we do as an organization. To achieve our mission, the following goals were identified: accelerate discovery to cure psoriatic disease, improve health outcomes, and achieve goals to help reach our mission, whether it's being involved with an event or becoming a volunteer. By attending today's program, you have already taken a step towards expanding your knowledge about psoriasis and psoriatic arthritis to help manage your disease and to find others who understand what it means to live with psoriatic disease. You can help accelerate efforts toward a cure and greater understanding of psoriatic disease by participating in the MPS Corona National Psoriasis Patient Registry, which is the largest independent observational registry of psoriasis patients in the U.S. The registry, which involves a network of dermatology clinics, collects and studies patient health information, allowing researchers to compare the safety and efficacy of psoriasis treatments, better understand conditions that are related to psoriasis, and explore the history of the disease. You can also share your experience with researchers about what it means to live with psoriasis and psoriatic arthritis by participating in Citizen Scientist. Answer questions and view your data along with 3,600 other participants. Data is used to help researchers gain a better understanding of the disease. To learn more and participate, visit the websites listed on the screen. And we continue to improve health outcomes through our Patient Navigation Center, the world's first personalized support center for people impacted by psoriatic disease. The Foundation's Patient Navigation Center is available to help you find physicians, treatment information, navigate insurance issues, access support through a one-to-one program, and more. Contact us at 800-723-9166 or visit psoriasis.org/navigation center. And to achieve the Foundation's goals as mentioned, please support our mission through donations or by participating in local Team MPF events near you. On behalf of the National Psoriasis Foundation, I'd like to recognize our sponsors, Celgene, Lilly, and Novartis. Without their support, this educational program would not be possible. Thank you for your support. And now I would like to introduce tonight's guest speaker, Dr. Craig Teller of Bel Air Dermatology Associates in Bel Air, Texas. Dr. Teller is a board-certified dermatologist and fellow of the American Academy of Dermatology who has been practicing since 1995. He is an honors graduate of the University of Texas at Houston Medical School, and prior to establishing Bel Air Dermatology with Dr. Howard Gerber, in 1997, he served as a staff dermatologist at the Diagnostic Clinic of Houston. Dr. Teller holds an academic appointment as Clinical Instructor of Dermatology at Baylor College of Medicine, as well as Clinical Instructor of Dermatology at the University of Texas Medical School in Houston. He has given more than 100 presentations and lectures nationally and has also been recognized as a top doctor by his medical peers in several national publications. Dr. Teller is the author or co-author of articles published in the Journal of the American Academy of Dermatology, British Journal of Dermatology, Psoriasis Advanced, EADV, and poster exhibits at national and international meetings. When not practicing, Dr. Teller enjoys spending time with his wife and son, traveling, wine, and sports. Welcome, Dr. Teller. We are so pleased to have you here tonight, and I'll now turn things over to you.
Kathleen, thank you very much. And for those of you on the line, welcome. And depending on where you are, either good afternoon or good evening. As Kathleen was already mentioning, psoriasis is something that I'm extremely passionate about, taking care of patients with psoriasis, finding better ways, And one of the things that plagues you that have psoriasis is when your psoriasis will flare up. And flares, I have a very broad definition of what a flare is. For me, a flare can mean that it's very individualized. And so it means not just the medical textbooks definitions that, hey, I've got huge amounts of my whole body is turning red, but I'm very much about customizing and teaching patients to be advocates. Hey, this is a flare to me. I'm not okay with it, and I really think that we make up our own definition for what we're looking for here. So what are we going to be talking about today? Well, we're going to be focusing in, although we can talk about really anything psoriasis. What is a psoriasis flare? Obviously, anytime you've got a chronic condition, we want control. I as a dermatologist, want you, the patient, to have control. And when you get flares and you can't seem to identify why your psoriasis is flaring, it is extremely frustrating. So try to come up with some ways that we can look at and say, hey, this is why we flare at times, and if we can have a little bit more control of a situation or a condition that feels helpless at times, is going to make you feel a whole lot more powerful. Additionally, it's what I've talked about, treating flares on my own, which was the third bullet point here. How can we teach you some pearls to do it, to use at home? I wish we could make it as interactive as possible, because I think a lot of people have picked up on pearls that they can share with their fellow patients or colleagues who actually have psoriasis as well. And then when we're getting a flare, it's something we can't treat on our own. What prescription or medical treatments are effective, as well as off-label treatments, meaning some more holistic treatments as well. So without further ado, let's take a look. This is just literally a definition I made up myself of what is a psoriasis flare. And I think this is completely independent. This is what you, the person who has psoriasis, what do you think it is? So in general, for me, it's any worsening of psoriasis beyond its original amount. And the flares can be worsening of existing psoriasis, so you don't really get any new areas, but the existing areas become redder, thicker, scalier, more looking like they're infected with scabs or crusts, and they become not flare. Additionally, these new or worsening of existing areas can become very itchy. Don't forget painful. And this is something for everybody to remember. You need to articulate what your symptoms are to your practitioner and let them know. People used to think years ago that you couldn't have itch and pain at the same time. And in actuality, you can. And I think you guys can articulate that better than anyone because y'all experience it. So itch and pain together of existing areas, or there might be new areas that are developing beyond the existing psoriasis that you have. It could be that your psoriasis has been previously controlled or even in remission, and now all of a sudden psoriasis is starting to begin to flare. The flare additionally can be very localized, and this is where I talk about you personalize what it means to you. Is it localized? I've got one little area, it's always been under control, and now it's flaring. Whether it might be an area of your scalp or wherever it might be, or is it more widespread across the entire body? And obviously, if you've experienced that, we are really fortunate to be in a situation now with new advances in medications that really can put you back into control very, very quickly. And then just one last comment on that last bullet point about being very itchy, uncomfortable, painful. One of the unique things about dermatology and having psoriasis is if you were actually in pain, like orthopedic conditions or neurology conditions, we can actually treat pain. We've got analgesics and medicines directly at pain pathways to make you or help you be more comfortable. On the other hand, itch is still something not well identified in the medical's research. We don't really understand how to control itch, where it comes from. And that's one of the things that can be very, very maddening for anybody with a skin condition, particularly psoriasis. So do advocate for yourself. I find that when I talk to my colleagues and even other physicians and physician assistants in my office, they often forget to talk to the patient and say, hey, how much body surface area do you have? Might you have arthritis? But always remember, itch and discomfort to me are a big deal, and we need to address those. So what does a psoriasis flare look like? It can be of what we call in medical terms morphology. It can be of any shape and size, and that means guttate. It can mean that you may have new guttate flares. Guttate literally means like little drops. So it looks like if you've ever experienced a guttate flare or guttate psoriasis, like someone's taken a little dropper and put little drops of psoriasis across your body. It's maddening because it makes it extremely difficult to be able to treat that with even a topical medicine, because by the time you connect all those little drops or dots, it will take forever, and you literally be covering almost your entire body. The classic for guttate psoriasis is still to this day, we see a lot of guttate psoriasis flare after a strep infection, particularly strep throat. A pustular flare can be localized or it can be widespread. A pustular flare is much more of a serious condition. It can be literally small little, as like we have with acne. You guys that have psoriasis understand that you can end up with little areas that are pustular, but these areas that are pustular can then be lakes of pus. And I don't mean to gross anyone out, but you've experienced it. They can be lakes of pus that can spread across entire areas of your skin, whether it be an extremity or on the chest or the back. Erythrodermic, literally erythro means red, and dermic means skin. So it means that literally your entire body is turning red. Erythrodermic psoriasis, fortunately, is not as common anymore. With erythrodermic psoriasis, we really do look at that as an urgent condition. It used to be years ago that we would actually hospitalize patients for erythrodermic psoriasis and perhaps even pustular psoriasis. Not really always sure on the cause, what causes erythrodermic flares, but one thing to mention backwards for a second is just on pustular psoriasis or pustular flares. The classic for that is someone who might go on oral steroids like prednisone or a Medrol dose pack. And when you come off of that very abruptly, that would actually be a pustular flare. And that's the one that also can be very dangerous as well as very uncomfortable. And then again, you may have a flare where your psoriasis is not looking any differently, but it's just spreading to new areas that weren't previously involved. And by all means, I would certainly consider that a flare. And then worsening of existing psoriasis. So it may mean that the psoriasis has been pink, the scale has been gone, you're not having to follow yourself around with a dust buster and clean up all the flakes and scales, but now all of a sudden it's turning very scaly, very flaky, heaped up, red, more intense. That to me is a flare, even if it's a localized area. And then we talked about you don't see itch, so you can't see what it looks like, but you certainly, y'all understand, you feel itch, you feel pain, and those are two big things to remember. So let's move into what causes a psoriasis flare. Number one on the list by far has to be stress. I don't know anyone who doesn't encounter stress in our daily lives. There can be fluctuations just like your psoriasis that fluctuates and waxes and wanes. Obviously, stress can wax or wane as well. But when that stress is very, very high, there is a very, very strong correlation to exacerbating or worsening your psoriasis. But at the same point, just having psoriasis can stress you out as well, because at times, I call it treatment fatigue. People get tired of taking care of their psoriasis. And you want to just say, forget it. I don't want to do anything for a while. I'm stressed. I don't want this condition. So in general, stress can be huge. You guys live it every day. We all know whether it's personal stress in our lives, business stress, financial stress, it doesn't matter the cause. Stress in general will always make any medical condition worse. But we know with psoriasis, there is a direct correlation. So what can we do quickly to alleviate stress? Meditation seems really hard. I will tell you it's not something that I have ever tried, but I know friends that have actually given meditation a try, and it really is a little bit more of mindfulness. It's not just making your mind go blank, but literally it's looking to see if you can just control so that as your mind wanders off, you just can stay focused and keep your mind quiet or calm. Because if you think about it, surviving in 2017 in our world today, our mind is on overdrive go all the time. So quieting the mind can quiet the psoriasis through meditation. Massage therapy. I think a lot of people find it's extremely relaxing. And if that's something you can do, massage therapy makes a huge difference. I'm a big personal proponent of exercise. I always say that if I'm not able to exercise regularly, I wouldn't be able to handle my stress very well. When you exercise, remember we release chemicals, endorphins, that give us a little sense of a high, a small exercise high. Exercise also plays another direct role in helping not only just to reduce stress, but when we become more active, it's healthier for our joints, but it's also healthier in that we may help with weight loss. And there is a direct correlation there as well, that when our weight goes up, which stresses us out, as weight goes up, or weight goes down rather, psoriasis often can come under better control. And a lot of you guys have heard about TNF-alpha. TNF-alpha is one of the cytokines that can make the skin or the psoriasis inflamed. And we know that the highest amounts of TNF-alpha are located in the fat. So certainly if we can reduce our weight, we can reduce a lot of the available cytokines like TNF-alpha, and that certainly can help to make the psoriasis better or reduce a flare. You know what? If it works for you to come home and use a relaxing bathtub soak, do so. That's a great one. In my mind, I take it a step further, and I do what I call for my patients environmental isolation. So that means you may go and do a relaxing bathtub soak with the door closed, no one else allowed around. Isolate yourself with whatever you like, whether it be reading a book, playing a game on the computer, listening to music, but isolate yourself from all the other stresses that are causing problems and create your own little blissful zone, even if it's only for 20 minutes in our busy lives nowadays. Obviously, connecting and support from family and friends can help. And the big thing to not forget about is the National Psoriasis Foundation. If many of you are on the line, you recognize that the NPF has the Patient Navigation Center, so you can literally get someone to connect with on a one-on-one basis with using this www.psoriasis.org. That can be your group of support as well, with an amazing number of tips, particularly for people who are already suffering or dealing with psoriasis. So stress, a really, really big one. The other one is alcohol. We don't really understand, but we've known for years that alcohol, beyond normal amounts, outside of moderation, heavy drinking can trigger psoriasis flares. And I get it because life is stressful, having psoriasis is stressful, so I call it self-medication. A lot of people use this to self-medicate and reduce their own stress or their own anxiety. There seems to be something genetic that makes people with psoriasis more prone to alcohol addiction or alcohol excess. And in my practice, I can tell you I've seen this time and time again. Patients who have been on biologic medications, very high-functioning folks, and when they finally, I try to create an environment where they're willing to tell us, hey, no, we're not making any judgment, but I'm drinking too much. I am an alcoholic. When they finally are able to cut back, they're actually able to stop almost all of their psoriasis medications. Many of them have stayed off of all medicines once they have stopped drinking. So as we've already talked about, try other methods for stress reduction or anxiety. We're moving now into December, close to Christmas time. Psoriasis is one condition that is notoriously worse with cold or dry weather. Don't really fully understand why the cold will exacerbate psoriasis. Probably the big connection would be the low humidity. So when it gets cold, the humidity levels drop. If you weren't familiar with it, what ends up happening is we actually pull moisture from the air that's into our skin to help keep our skin moist and to keep it moisturized. That's called a humectant effect. And so as it gets cold, the humidity drops, making it much more difficult to keep our skin moisturized. Keeping skin moisturized, it gets to be a vicious cycle. Keeping the skin moisturized helps to make the psoriasis in our skin healthier, so we're able to deal with environmental assaults and the low humidity conditions. One thing to be aware of as we're all visiting relatives in Thanksgiving or Christmas time is airplane travel. Airplane travel, be prepared before you leave or even in flight and post-flight. I've seen people who immediately will start to flare. The airplane environment is low humidity. So be aware, especially if you're going on longer distance flights. Moisturize while the skin is wet when you're dealing with cold or dry environments. So most people know this already, but when you get out of that bathtub or the shower, immediately pat dry, but leave the skin somewhat wet. Please, please don't rub. It feels good, but it's going to stimulate more itching and potentially aggravate the psoriasis. When the skin is wet, apply your moisturizer using brand names you might know like Eucerin, CeraVe, Cetaphil, Fanny Cream, whatever you find most effective. But don't forget to lock in the moisture. And doing that is often best done with things like ointments like Vaseline or Aquaphor. And so that would be my best bets for using combating cold or dry weather to help prevent psoriasis flares. One other pearl is certainly if you're in a very low humid environment, humidifiers can help and add some of that moisture so that while you're sleeping at night, the skin can actually pull some of the moisture out of the air. This is a huge one, and this isn't fair to those of you with psoriasis, and that is injury or trauma to the skin always will worsen psoriasis. And in fact, as you can see in the picture, it actually creates an exact effect that we call the Kebner phenomenon. So you can see literally in that picture that somebody was scratched in that area. And then what happens is the psoriasis will develop wherever the skin was injured. So pay close attention as cuts and bruises are healing up, to watch to make sure that psoriasis isn't flaring. By the way, this can happen with things like sunburns. Initially, I know we like sun and we like light for psoriasis, but be aware too much sun and sunburn can act as an injury to the skin and exacerbate psoriasis. Even things like bug bites, mosquito bites, I guess the one good thing about being in the wintertime. We don't realize that we often traumatize our own skin. It's hard not to when it itches, but picking your skin, picking your psoriasis, pulling off the flakes, rubbing it down so that you can try to thin your psoriasis down, traumatizes the skin. And in fact, what that will end up doing is making more psoriasis, again, the Kebner phenomenon. And then don't forget things that we don't always think about. Tattoos and piercings, not uncommon to start to see psoriasis develop freshly after that has been happened or performed. Pay attention to medications. They can be prescription medications. They can be over-the-counter medicines. Psoriasis can be flared by all medications. The classic medications are medicines like beta blockers. So the medicine that you might have heard of, the generic names might be things like metoprolol or propranolol. They always generally end with olol. And those are medicines often used for blood pressure, sometimes for migraine headaches, Beta blockers also used for people who sometimes have had heart attacks. So beta blockers, a very common medication that sometimes can flare psoriasis just as you start that medicine, or make it just more challenging to get your psoriasis under control. Another blood pressure medicine prescription is called an ACE inhibitor. Example might be like captopril or lisinopril. Those are usually blood pressure medications, and they also can flare or make psoriasis worse. One of the ones that is got a very specific use, but if you're dealing with things like bipolar disorder or manic disorder, lithium is a medicine that has been often used to treat that. Lithium will flare up psoriasis. When you have other conditions where Plaquenil is an anti-malarial agent used years ago for malaria. We don't use it anymore in medicine for malaria, but what we find is it's often used for rheumatologic conditions like lupus, so even skin lupus. So Plaquenil or hydroxychloroquine can be a medicine that can flare up your psoriasis. NSAIDs, we call that NSAIDs, and that's non-steroidals. What does that mean? That means your over-the-counters like ibuprofen, Advil, Aleve, Motrin. They, believe it or not, are medicines that we use a lot for psoriatic arthritis or joint pain, but at times they also can flare up psoriasis. So just watch for that temporal relationship. I started this new, and now it can flare up, or it might flare up. And there are also prescription non-steroidals. The classic ones that people may be familiar with are medicines, brand names like Mobic or even Celebrex. Other things that can flare psoriasis, and this is the opposite effect, coming off of a medication. So a rapid discontinuation of a systemic steroid. The names that you might see are prednisone, prednisolone, a Medrol dose pack. Anytime you've been on one, you may have had a bronchitis flare, asthma flare, might have had bad poison ivy, whatever it might be. Docs who are not dermatologists and not aware that you have psoriasis will often have you come off of these medicines pretty rapidly. And when you discontinue that medication, that rapid discontinuation of a systemic steroid can cause a psoriasis flare, and in fact, as I mentioned earlier, a pustular psoriasis flare. The other one I always warn my patients about, a lot of doctors, ENTs, orthopedic surgeons, they like to do a lot of cortisone injections. Cortisone injections put a depot of cortisone or steroid in your body. And as that cortisone, you forgot about it because you got a shot, you weren't taking pills, guess what ends up happening? As that cortisone shot starts to wear off, it can happen very rapidly, and that can lead to, again, a severe flare of your psoriasis. The other tricky one that people don't always think about is the steroid inhalers that are used for allergies or asthma. If you're using some strong enough inhalers for respiratory conditions you can actually, when you stop that abruptly, can also end up, you've absorbed enough of it through your blood or through your mucous membranes of the respiratory system that then when you stop it abruptly can lead to a psoriasis flare. We've talked about infections. We talked about that with strep throat. Strep throat often will cause a guttate psoriasis flare. If I see recurrent guttate psoriasis in someone, even if they have mixed, they may have medium, small, large plaque psoriasis, but now they keep getting recurrent guttate psoriasis, I always check for strep throat. I have now sent several patients who have developed recurrent strep throat to get tonsillectomies. What's happened? Most of these patients have been able to come off of their biologic medications for psoriasis. Why? The tonsils colonize or hold in their crypts strep bacteria. So it's a hidden place where strep bacteria hides for a lot of people. So it depends on your age group. If you're older, or I would say I got to quantify that because I'm 52, but my age group, everyone had their tonsils taken out. But I would say in the younger generation, probably at least 10, 15 years younger than me, it went out of vogue to take your tonsils out. So pay attention to that. Yes, you have psoriasis and you can have staph and strep on your skin. That you can't help. It's out there. It's colonized around us. But there are ways to decolonize so that then the staph or the strep don't become out of control. How can we do that and control it on our own at home? A couple of ways. Believe it or not, bleach baths are extremely helpful. We've told our eczema patients to do this for years, and it's something that I've been telling my psoriasis patients to do now, and that is take anywhere from a fourth to a half of a cup of Clorox bleach. Yes, Clorox bleach. And it's very safe in putting it into a full warm bathtub. Soaking in that bathtub, if you have a lot of infected areas on a daily basis for a week, can really decolonize you and help clear up the small infections that flare psoriasis. So that's a really good one to remember. Yes, bleach does dry out your skin a little bit more, so you're going to need to add moisture. But bleach has some, people don't realize this, inherent anti-inflammatory properties. And so that allows us to actually calm down the psoriasis as well. The other bullet point that I have there about decolonization, the other way that you can do that is many of us, particularly in the healthcare field, will colonize staph bacteria in our nostrils of our nose, under our fingernails, in the creases of our groin, in the underarms. So if I suspect that someone is recolonizing and feeding staph back onto the rest of their body, I'll try to decolonize by using prescription topical medicines like mupirocin, or the brand name people are familiar with will be Bactroban. And I have them put it into their nostrils every night for a week, under their nails, the creases, and you know what? They do decolonize a lot of the staph, take away the staph load on the skin. Don't forget, even though we think of bigger infections, flaring psoriasis, common infections can do it as well. So believe it or not, even a woman who develops a vaginal yeast infection, innocuous things that you don't think about, athlete's foot, you're living with it, you don't even realize you have it, and then all of a sudden it's enough because your body's fighting off a mild fungal infection, it makes it harder for you to clear your psoriasis. If that fungal infection is bad enough, it can cause you to flare psoriasis. The other prototypical flare with psoriasis is often caused by what we call a URI, and that stands for upper respiratory tract infection. So that's kind of your classic cold that involves more than just your nose. Feels like it's going into your throat and chest as well. Smoking is 100% correlated with flaring or worsening psoriasis. Tobacco, nicotine is incredibly addicting. But if you want an incentive to see about making your psoriasis go away, that's your chance. If you stop smoking, I think you'll find, I don't want to promise that your psoriasis will go away, but I would tell you it's going to lessen the flares that you have and make it easier to control your psoriasis, particularly if you have hand-foot psoriasis. It's not a hard and fast rule, but I find that a lot of folks who have hand-foot psoriasis, high correlation with smoking. So we've talked now about what might cause some of those flares. Let's take a look at how we might approach some treatments for localized flares beyond some of the over-the-counter or things that we can control at home. So if you go into your dermatologist's office and you have a particularly refractory, recalcitrant area that just won't go away and it's very localized, intralesional corticosteroids or some people call it ILK, literally means using a tiny needle and injecting small amounts of liquid cortisone directly into the psoriasis plaque. It's a great way to get a quick, rapid reduction and a reduction of itching as well as melting away the psoriasis. It's something that we can do on an as-needed basis, but should not be used regularly, because if you do it regularly, a couple of things are going to happen. You'll thin out the skin. The skin will get atrophic. You'll create new broken spider veins or redness in that skin. And then if you're doing it too much and not just on a periodic basis, you will actually get a rebound effect where the psoriasis will rebound worse than it originally started that you were treating it with. Another way to treat localized psoriasis is using a topical steroid under occlusion. So topical steroids, everyone has different brands that are out there. Some of the generics might be like clobetasol or betamethasone dipropionate or desinide, triamcinolone. If you take that topical steroid and you put it under occlusion, what that occlusion does is help the psoriasis to help the topical steroid to penetrate through that thick psoriasis plaque much better. And when you do that, you cover it with usually saran wrap or tape. And those are ways to get the psoriasis, the steroid to penetrate into the psoriasis a whole lot better. One medication that is back on the market is a topical steroid that's adherent onto tape. So it's already impregnated into the tape. It's one that is just easy because it's clear, and so people can't see it. You can cut and apply it to very difficult areas. And that's a brand name that's called Cordran tape, or fluogenolide is the generic name. Another way to deal with localized flares is what's called the excimer laser. The brand names for the excimer laser, the two most common, are the Pharos laser or the extract laser. They put out a wavelength of light, usually about 309 nanometers. What's so special about that wavelength? That wavelength does not burn the skin or create skin cancer. It actually acts as an anti-inflammatory to calm down the psoriasis. The nice thing that I like using, and by the way, you can combine the excimer laser with any other treatment very safely, but one of the things I do like about the excimer laser treatment or any phototherapy, it has what we call a remittive effect. So what that means is with a topical steroid, you apply it on your psoriasis. The way a topical steroid works is it constricts the tiny capillary vessels that go up into the skin. Therefore, you're not able to release all the itchy cytokines and chemicals that flare up and inflame your skin and make the psoriasis. When the topical steroid wears off, so 12 hours later or the next day, the blood vessels pop back open again, and if you notice, it flares back again. So if you use a treatment like the excimer laser, this can actually create a remittive effect. So you might do treatment for 4 to 6 weeks or 8 weeks, stop the light treatment, and guess what? Your psoriasis can go to sleep or do what we call a remittive effect. So I've seen it where it can last, a remission can last as long as a year. You know what? If it lasts a week, it's a blessing. At least it's a week or two without having to use treatment and can get you out of that localized flare at the same time. So what about treatment for moderate flares? This is when I like to look at using wet wraps. So if you have enough of your body surface area, and if you've noticed, I don't correlate a body surface area with what is a moderate flare. A moderate flare is what my patient tells me they think it is. So if they say, hey, this is a really significant or moderate flare for me, I'll be aggressive and say, let's try some wet wraps. Wet wraps, as most of you know, you take topical corticosteroid, apply it all across the area. Again, best penetration right after you get out of a bathtub, keeping the skin damp and massaging it in. Again, usually using Vaseline or Aquaphor if you really need to in a pinch. Crisco can work, but use that to massage in. And then wrap around either warm wet towels, or you can even use with wet wraps things like a terry cloth robe, cotton clothing. But those wet wraps for moderate flares can really help get it under control literally within a few days if done very effectively, and the steroid that we use is potent enough. Moderate flares also respond nicely because it's moderate and it's not a huge amount of your body most of the time. We can do things that take a little bit longer time to work, and one of those things would be phototherapy. Again, the most common form is the in-office phototherapy, and that's going into what we call the light box. The light wavelength that we use is narrowband UVB, so it's 311 nanometers. Again, the same concept. That light wavelength calms the psoriasis, but doesn't injure the skin to make more skin cancer. So it's a really nice effect. So phototherapy, particularly in the wintertime when we don't have as much sun, not only does it help the psoriasis, it also can help your mood and help us feel better. And if you help the mood, we obviously know the mind-body connection. We can help calm a psoriasis flare. If it's too hard for you to get into the office, to your dermatologist's office, you can look at home phototherapy. And that's something to talk to your dermatologist about, where you can control it at home under your own time constraints. Certainly with moderate flares, we can look, since we're not in a rapid rush, you're not red all over, so we can go with something that still works in a reasonable time frame, and that would be systemic agents that are alone or in combination with other treatments. The classic ones, once you start to look at a moderate flare, might be methotrexate, generally taking that as an injection or pills once a week. The systemic retinoids. Systemic retinoids would be something like soriatane or acitretin. It tends to be much slower, so just be aware if that's something that you're using. Cyclosporin is our quickest and most rapid agent to cool down significant inflammation. And cyclosporin has names like Neoral or Gengraph. And then lastly, there's also apremilast, which is one of the newer medications on the market with the brand name Otezla. And that's also one that can potentially use for a moderate flare. Some folks, we say, hey, you know what, the moderate, whatever it is, it's too much. I know I want this to go away and be under control. We use biologic agents all the time. Biologic agents, the nice thing is we keep seeing an expanding amount because they're targeting the exact, or not the exact, but the immunologic overactivity cause of psoriasis. And so we can use any of the biologic agents, even with a moderate flare, and that would be medicines like etanercept, which is Enbrel, adalimumab, which is Humira, infliximab, which is Remicade infusions, ustekinumab, which is Stelara, secukinumab, which is the brand name Cosentyx, ixekizumab, which is brand name Taltz, brodalumab, which is one of the newer ones as well on the market. And that brand name is Siliq. And then probably the newest would be guselkumab, which would be Tremfya. Now, most of the biologics, we're going to be looking at how quickly they act. For a moderate flare, we can use almost all of the ones that are on the market because whether they're slower acting or faster acting, we still are going to be able to take care of a moderate flare with that medication. What about a severe flare? Now, this is important. We need to act quickly. This can be really dangerous. It's going to be when your skin is widely flaring. It's highly itchy. It's painful. You can't regulate your body temperature as well. Your skin is cracked and broken, and you're having trouble controlling potentially the ability to get microbes or germs, bacteria into the skin. And so we want to be able to have very rapid acting agents. So this is where, in my mind, when you have a severe flare, the medicines that I would be my go-to obviously has to be dependent on what your personal medical conditions are. One would be cyclosporin. Cyclosporin is a medicine that obviously looks like it has a lot of side effects if you've read about it. But I will tell you, when we look at turtles and we look at rabbits, cyclosporin is definitely the rabbit of psoriasis control. Very quick acting. And it can be done very safely for a short period of time. Cyclosporin is a medicine long-term, if used, can elevate the blood pressure and start to cause problems with the kidneys. We don't use it that long, but remember, don't be afraid to go on the medication. Very, very effective, especially for controlling a severe flare, tapering off the cyclosporin then onto another medication that we can use for longer-term control. The other treatment that a lot of us use for a severe flare are systemic steroids. Prefer not to use a cortisone shot because you can't control how quickly it goes away or control the dose, go up or down on the dose. So I prefer to use pills. This is not something to use regularly. If you were to use it regularly, a lot of problems. It can thin or weaken the bones and cause osteoporosis, can elevate the blood sugar and make diabetes worse. It can increase blood pressure. Systemic steroids can also affect the immune system over time. And then lastly, with systemic steroids, if you use them and then you came off too quickly, like we talked about before, they actually can cause a flare. But using systemic steroids with a slow taper. In fact, I like to design my own tapers, which is why personally I avoid any of the tapering dose packs. I like to make it go at my own discretion based on that patient's condition. And then systemic antibiotics, because generally with a severe flare, we know staph and strep are overgrown in the skin. Antibiotics that target those specifically can help work in combination with the other medicines to treat a severe flare. Can we use biologic agents to treat a severe flare? Yes, but we now need to go with the medicines or the biologic agents that have a quicker onset of action. And this I mean by we're going to see effects within a week, maybe 2 weeks. So those medicines that have those characteristics, the biggest that we've used for a long time would be infliximab or Remicade infusions, a very rapid onset of action. Other biologic agents that can do this would be a medicine like ixekizumab or Taltz or secukinumab or Cosentyx. Using those medications, we've seen people get controlled often within 2 weeks or less. Brodalumab, Siliq is the brand name. I've helped with perform the clinical trial for that medication and literally saw people who were flaring controlled within a week. It was really pretty impressive. And we're seeing that same type of effect with one of the newest biologic agents that also has a very quick onset of action, and that is guselkumab, or the brand name would be Tremfya. Years ago, someone had a severe psoriasis flare. We had, and I don't know if anyone still uses this, is what we would call a psoriasis daycare center. Literally, it would be an inpatient unit in a hospital, and the patients would get combinations of wet wraps, light therapy or phototherapy, even tar baths. And these tar baths with this combination would be what we call the Geckerman regimen. So it's still something that, if it were available, is an older but still effective way to control a severe psoriasis flare. I'm open-minded, and if people find something that works for them, I'm great with it. And so natural or home remedies are things that if they work for you, by all means, go with it. The thing that we have to follow in medicine, and it's why a lot of the doctors may not always be as open-minded with it, as they say, it may work for you, but I have to use things that show reproducibility, that can be used over and over again, and I can count on knowing scientifically that I can count on that consistency of working. So don't forget about natural or home remedies. You know what? Some people like to go to a healthy diet. things that are very high in omega-3 fatty acids. And so as you do that, things that have flaxseed or salmon and a lot of the oilier fish. So a healthy diet can make a big difference here. Again, you're having a big flare, meditation, yoga, increasing your exercise actually can make a big difference as well. Getting outdoors, getting into the sunshine, particularly that environmental isolation of getting to the beach. It's the only time you'll find a dermatologist telling a patient you can go get in the sun, but please don't get sunburn, because again, that can cause a flare. But the combination of salt water, so any like a salt bath, salt water in the ocean, the sand, and as well as the sunshine and the relaxation of being out there actually is a natural remedy that can actually help to improve psoriasis. Baths as well. We can use and focus on the sea salts. Again, those are very effective. I have some patients actually start to use some tar baths combined with Aveeno oatmeal. Using those can make a big difference. Aveeno or colloidal oatmeal or natural oatmeals put into a bath. Tar solutions you can generally find over the counter. No affiliation or association with any of those, but one of the brands that I happen to like is Balnatar, or even taking the T-Gel shampoo from Neutrogena, putting those into the bath with the Aveeno. That can make a natural or nice home remedy. Again, any of your pearls to help with avoiding stress. Scalp health is really worth talking about for a minute, because scalp psoriasis is really challenging and can drive you crazy. Scalp psoriasis, we forget that there's two components to this, and you may need to occasionally remind your dermatologist, because what will happen is you can start to get the psoriasis under control, but the area continues to itch. And once you scratch it, as you scratch it, the skin plays a dirty trick and creates more itching. So it can put you into a really difficult cycle. And as you get into that cycle, it's the itch, scratch, itch cycle. So before you know it, you've got a small little area on the back of your neck or on the lower part of your scalp, and you itch it, it itches, you scratch it, you go through that cycle. Before you know it, scabs, you're picking off the scabs, it's bleeding, and it makes a crusted, scabby mess. And we often call that what we call a neurodermatitis, because now it's really a habit, and it's actually become a vicious cycle. So you need to recognize, for scalp health, really do pay attention to anything where you're picking. It's an area that we unconsciously rub or scratch. What are things that you can do naturally to help with scalp health? It sounds silly, but taking things like ice cubes and applying it right to the point of the itching and holding it there until it stops. Taking a wet or a cool towel. It sounds crazy, but putting it right onto those areas, a towel that might be dampened with moist and put into the freezer, and then applying it onto the area, almost like an ice pack onto the scalp. But also don't forget about scalp health. And that means it's important, if you have psoriasis, to shampoo almost on a daily basis, because what the shampooing will do is help to wash away the flakes and the oils that seem to sometimes exacerbate or kind of tickle the scalp to make more itching. If you're going to shampoo, the over-the-counter shampoos that make a big difference, look for certain ingredients. Obviously, an ingredient like zinc parathione, which is in Head and Shoulders, but it has to be the one that specifically states that it has zinc. So any zinc-based shampoo is a big help. It's anti-inflammatory, calms it down, helps stop the flaking. If you've got a lot of flaking and you want to detach those flakes, detaching flakes, whether it's on the body, which we didn't mention earlier, but we can use urea or salicylic acid compounds. But when it comes to the scalp, specifically a salicylic acid shampoo like T-Sal from Neutrogena or other salicylic acid shampoos can really help do what we call a keratolytic effect, or help take away those flaky areas. And then it helps to make the scalp feel healthier and help calm or prevent a flare. Other things, if you have dark enough hair, tar shampoos, although they can smell, really do make a difference. Selenium sulfide shampoos like Selsun Blue. And then the other one is that has an over-the-counter and a prescription strength is your Nizoral or ketoconazole, an anti-yeast shampoo, also makes a difference. And then don't forget, remember, your skin needs moisture, your scalp needs it as well. So don't forget to use a conditioner as an important step with scalp health.
Excellent. Thank you so much, Dr. I'll go ahead and jump in now and pose some questions to you for the Q&A portion of our webcast. We've gotten a number of great questions both in advance and during today's presentation, so we'll get to as many of those as we can with the time that we have remaining. So, Dr. Teller, is there always a trigger for a flare? This person says, sometimes I get a flare-up and I cannot figure out the trigger. Is this common?
Unfortunately, it is. There is not always a cause and effect. So that's the tricky thing about psoriasis, is it waxes and wanes. We try to be a detective and figure out what was the trigger, but you're absolutely right. Psoriasis can flare at times, and we don't understand why. So we're still looking for the holy grail of what those triggers are that set it off that we don't understand right now.
Yeah. And a lot of questions that are kind of a variation on this one here. How do you tell the difference between a flare and a drug failure?
Sure. So there is a difference. A flare is worsening of your psoriasis. It means that the psoriasis is getting, as we talked about, getting thicker, there's new areas, or it's more symptomatic with more itch or pain. A drug failure, to me, generally means you have the existing amount of psoriasis, you're seen back by your dermatologist, but the psoriasis just isn't budging. But generally, the medication isn't going to make you flare and create new psoriasis. It's just going to fail to treat the existing psoriasis. So that would be a treatment failure, whereas the flare, new or worsening areas.
Excellent, thank you. Also gotten a lot of questions about flares and being on biologics. So this person asks, how common is it for there to be flares after you are on a biologic? And kind of a similar question here, can a flare be triggered by taking a biologic or by stopping a biologic?
Great questions, all of them, and totally understand where you're coming from that, because as a practicing dermatologist, I think about it myself all the time. So here's, first of all, the most reassuring information. If anyone's been or had psoriasis long enough to remember a medication called Raptiva. Raptiva was a biologic that worked particularly well as a T-cell blocker for the hand and foot psoriasis. Raptiva was the one that if you stopped it, you could get a flare of your psoriasis. So ever since that time of Raptiva being out years ago, it's now off the market. What ends up happening is almost all the medications, when they're in their clinical trials, going through their FDA approval process, there's almost always an arm. I can tell you, as we look at all the medications that I've listed, there's almost always an arm of the clinical trial where the patient's on the medication, they've gotten a response. And then what they do is they discontinue the biologic. And what we do is they watch and we count the amount of time it takes for the psoriasis to get to a loss of 50% of the control. And at that point, they look and say, if that were to happen very, very quickly, we know that that would be a medicine that's flaring or could cause a flare with withdrawal. That is something that is tested and looked for, and we're not seeing it with any of the new biologics. Certainly, it might happen to someone once occasionally, but it's not common at all because we're testing and looking for that. The other thing is we look for the quantity of time. So if you were to come off of a medication, because at times people have to have surgery, they have to travel to a foreign country, can't take their medication with them, And so we look at then how long will you stay clear on average after you stop that medication or the biologic, and that's something that's also tested and looked at with the clinical trials. Can a psoriasis medicine in and of itself induce a flare? It's not something that I have seen. I've seen people who might have perhaps a hypersensitivity reaction to the medicine, but that rash is going to look much different than the psoriasis itself.
Great information. All right, we'll try to squeeze in one more question here. This person says, what can I do as I never seem to not be in a flare? Do you have any advice for this participant?
Wow, that's challenging. And that's one of the ones that I would find out, in your community, who is really the best at treating psoriasis. Because if you can't ever seem to get out of a flare, that's when, to me, I want somebody who's truly passionate about psoriasis treatment and going to be a detective. Is this all psoriasis? Could there be something else that's mixed in with the psoriasis? Okay, it is all psoriasis. Let's take a look. You want someone who can use every medication comfortably and safely from A to Z so that it can get you out of this constant flare. It is really difficult. We'd love, which I think will be on the horizon, to do genetic testing and say, you have this gene profile, therefore this medicine is the one that's going to work the best for you. We don't have that yet, but that's why some people, just their genetic profile is they don't respond to a lot of medicines, but I've not seen someone we can't get them to respond to something. The problem with that is that there is what we call treatment fatigue or treatment failure that you've talked about, where it stops working. And so at that point, the medicine had you under control. You need to look and stop at the positive. What's the time period between I had control, now I start flaring again? And so that is at least looking at saying, I may be having to move and change medicines more frequently than your doctor would like and that you would like, but at least it might help get you out of that, and looking for what's the other one I was going to change thoughts there is the other thing to look at if you've not tried and you're in a constant flare is possibly going with with treatments that create what we call a remittive effect. And the remittive effect is often done with phototherapy. So if it's something you have access to somebody who has a light box, would certainly look at that. The other way, if you're constantly in a flare, to get creative in mixing things with a remittive effect. So there's medications that we can use, biologics and systemic medicines, that we combine with phototherapy. So I know it's a long-winded, probably non-specific, but it's one of the ones of don't give up. There is someone out there who's going to help get you into that comfortable spot again.
Excellent. Thank you so much, Dr. Teller. So it looks like it's about all the time that we have for tonight's presentation. I'm sorry if we weren't able to get to your question, but if you do have additional questions, please contact our Patient Navigation Center by phone, email, or live chat. And once you leave today's webinar, you will receive a survey on the presentation, and we'd greatly appreciate it if you would fill that out and provide us with your feedback. One additional thank you again to our sponsors, Celgene, Lilly, and Novartis. And finally, I just wanted to mention that a recording of tonight's webcast will be available shortly on our website, and you can access our complete webcast archive by visiting psoriasis.org/webcast. So thank you to everyone for joining us, and thank you so much to Dr. Teller for an excellent presentation, and have a lovely evening.
Thank you, everyone.